Welcome to the DC Bar Community's Law Student Podcast with your hosts, Sienna Hurd, 3L at American University, Washington College of Law.
Elena Hoffman, 3L at the George Washington University Law School.
And Delali Dagadir, 4L at UDC David L. Clark School of Law. You're listening to Let's Brief It.
Hello, and welcome back to another episode of Let's Brief It. In today's episode, we'll be focusing on the perpetually important topic of mental health and addiction in the legal field with our guest, Nikki Irish. Nikki has over 15 years of experience in the mental health field with a focus on well-being and addiction. For over 10 years, she served as the senior counselor for the DC Bar Lawyer Assistance Program, or LAP, providing lawyers and law students with addiction and mental health assessments, counseling, consultation, and psychoeducation. Nikki currently serves as the Outreach and Education Coordinator for the LAP, providing a variety of trainings and educational seminars to law schools, legal employers, voluntary bar associations, and other legal organizations. Nikki has a BS in Psychology and Family Studies and an MSW from the University of Maryland School of Social Work, with a concentration in employee assistance programs. Nikki is also licensed to practice clinical social work in the District of Columbia. So Nikki, thank you so much for joining us. Could you tell us a little bit about your background and why and how you got into your current role?
Sure, although I think you just learned a lot about it. I guess one of the things I'd like to say is I got here by following kind of the path of what the right next step was. So it's not, if you had asked me in social work school, if this is where I'd be, I definitely wouldn't have envisioned it, but it is doing a job I love and work that I think is important. I have an employee assistance background. I took a little bit of time off to do some family therapy with foster care kids. And then almost 12 years ago now, landed at the bar. Started doing kind of one-on-one work with lawyers, law students, and judges, and then kind of transitioned to doing some educational presentations. And now, as you know, I'm kind of shifted into this new role, which you had mentioned, where I really enjoy basically normalizing the struggle of being human and helping reduce the stigma associated with mental health struggles and to raise awareness of the LAP and its services. Really wanting people to know that the help is available, they don't need to wait to seek it, and that basically by almost 12 years here, what I have found is I've seen hundreds of attorneys at this point, and so many of them have told me they wish they knew about the LAP sooner. So part of the drive for my current job in reaching out into the legal community is raising that awareness of people so that they know that help is available, free and confidential help is available, and that they could access it.
Sienna introduced it a bit in the introduction, but what exactly is the Lawyer Assistance Program? What can it help with? How do you reach out to them, etc.?
I'm going to reiterate the free and confidential part. It's accessible for anybody who's a DC bar member, any law student in DC who intends to become a bar member, and then any judge in the district. So it's a pretty wide population that we serve. And also, just as an aside, in case there's somebody listening who's not one of those kind of categories, almost every state has a lawyer assistance program. It looks slightly different depending on state to state. So New York might not look like DC does, which I'll explain in just a moment, but do know that there is a resource available to you in your state. So DC specifically is actually kind of benefits by its small size in terms of geographically. So we can see people for individual work. So clinically, that means basically short-term counseling. That means assessing and referring. So somebody comes in and says, I have a problem. We say, okay, let's figure out what the best resources are for that problem and kind of handhold you to getting to those resources. It can be, we have support groups for kind of lawyer well-being. Twice a year now, we have been doing bar prep support groups. So, before the February and July bar, kind of walking people through tools and things to help with their mental health to get them ready for the bar. So there's a wide kind of variety of individual services that we offer. And then we also offer these other kind of outreach services, which is more of the work that I'm doing now, which is going into law schools and legal organizations and educating people on mental health and substance use issues, well-being issues, trying to normalize some of these conversations that are happening and wanting to emphasize, I guess, that the services are very wide, right? So when I started, it was people had this perception that it's only I must have an addiction issue if I'm going to access the LAP services. And it's so much more than that. It can be, I'm struggling with just some stress of law school, right? Law school is incredibly stressful. That's not, I don't want to say that's all it has to be, but that's all it has to be. It could be I'm having some relationship issues, So it really can be anything that you can access these services for. It does not need to be on the far end of the mental health substance use spectrum. Our goal is really to be more proactive and preventative so it doesn't get to that point. So just really reiterating that for people.
Yeah, thank you for that introduction to the lawyer assistance program. And I really do hope that people will reach out and take use of it. So now we're wondering, why do you think it is that mental health and substance use issues are so much more prevalent among lawyers than in any other profession?
I guess there are a couple pieces I would want to say to that answer, right? I think there's one component that they talk about where there's like a lawyer personality. So Larry Richards is somebody who he was an attorney and is now a mental health practitioner, but does a lot of research into lawyer personality. And personality traits make them kind of different than the average person in that they have kind of lower resilience, significantly lower resilience than the average person, significantly like higher rates of skepticism, which means they are less optimistic. They have lower rates of sociability. So they kind of reach out to others less and connect less than others. So I think there's some personality traits that kind of make people more vulnerable. And then you enter law school, and that's chronic stress for 3 years. And then there's the nature, right, of it, where there is like the competitive nature of it that happens. There is the kind of unknown and navigating without always kind of the benefit of support. And then you kind of go into the legal world where those things carry over and you are the caregiver, right? Like you, as a lawyer, take care of other people, which doesn't mean you always take time to take care of yourself. And then there are the demands of the profession and job, right? Law school is pretty demanding in terms of time. And then that doesn't really get that much better when you are in the profession, depending on kind of what role you go into. So you end up maybe not taking care of yourself as well as you could. And they all build on top of each other. I'm going to stop there actually, because I could kind of probably keep talking about it. But the other piece is not seeking help. There's so much stigma around help seeking. So maybe you do have a problem and you've kind of recognized it, but there's so many barriers to the help seeking that it continues, right? Depression, anxiety, and substance use, amongst others, are things that are progressive. And if you don't stop them, they don't stop on their own, they keep going. So I would say those are just some of the pieces that make the law and law students kind of more susceptible to mental health and substance use issues.
You mentioned the 3 years of chronic stress that law school can provide. I definitely agree with that. What do you think law schools and employers could do to make their environment more accessible or friendly to those with mental health or addiction issues? For example, I've noticed that a lot of our law school events are centered around alcohol or are held at bars. However, I don't think bars are really a friendly environment for people who are struggling with addiction or mental health in general. So, do you have any advice on that?
Whew, I love your questions because they're so big. I'm going to actually start with the podcast. I'm trying to keep it relatively short. I'm going to direct people to, there is a national task force kind of on well-being. It's now transitioned into, it's called the Institute for Wellbeing in Law. And they have a lot of wonderful resources to answer this question. So if it kind of doesn't get answered the way you want to know what it is as you're listening to this, I think that's a really great resource. And let's start with maybe your point on drinking, right? So one of the task force recommendations is to have social events that don't focus on drinking. So instead of having the whiskey tasting, you have a bowling event where you might have access to a drink ticket, but you don't have an open bar. So it's really about what is the focus of the social event and thinking about it that way. It doesn't mean you have to completely remove alcohol from the event itself, but you can shift focus. And it makes it much more accessible and open for other people, whether in recovery or just those that aren't interested in drinking. There is a significant portion of the population that just aren't big drinkers, and that's okay. And you want it to make it accessible to them, right? And then so another, I think, really important action schools and employers can take is to have hard conversations or uncomfortable conversations kind of out in the open and to have them regularly. We need to destigmatize mental health challenges. And in that, I'm including substance use issues, right? But there needs to be regular programming on well-being, mental health, substance use. Leaders in whatever that space is need to be attending the programs and supporting the programs. I see that as a significant issue kind of in a lot of legal organizations. Is sometimes they even have the programs, but attendance ends up kind of being low because they don't think they have the time. So if you have leadership attend and support it, you're more likely to get other attorneys going. Having people out, people in recovery, like these ambassadors, right? Students and attorneys in recovery who are comfortable talking about their journey, and like have them have open door policies for people to kind of like go in and talk to them. All of these things can reduce the stigma, and that's really a significant issue, is making people more comfortable. Reducing stigma will help people actually seek help, and will make it less of a kind of a big deal, because so many people struggle with it, right? In general, in the general population, 1 in 4 people at some point will have a mental health condition. That's a really high rate. And then the one thing I actually want to point out, because I think it's particularly interesting might be to law students, is the ABA recently is passing or has passed some changes in terms of the curriculum. And they're actually requiring kind of well-being being incorporated into the curriculum. Well-being practices, I think, is what they talk about. And then that there's also going to be a requirement of kind of like professional identity formation. And in that, I think will be some well-being components. So there are a lot of other things too, but you can go research them yourself.
Absolutely. And you also mentioned that the stress that comes with law school often doesn't end upon graduation, and it can, extend and even exacerbate upon entering into your career. And this is another very broad question, so answer it as you see fit. But how can law students and new attorneys navigate toxic work culture and boundaries, especially in those high intensity jobs?
Another great question. And I want to say is something we see a lot of, right? Like, so my first part of the answer might be very carefully and intentionally, because even just acknowledging that it's existing is something, right? I think so often we kind of just put our head down and keep going without thinking about what's going on and what we can do about it. Ideally, I think it's with help, whether it's from a mentor, a peer, or a mental health professional, but like find your people who can support you in this process, because it's not meant to be done alone. And then kind of before addressing that like big piece of like the toxic work culture and boundaries, and that piece is kind of coming back to the basic aspect of well-being, because if you're not doing that, it is unlikely you're going to be able to do any of the other stuff, like address bigger things. And by that, I mean basic needs, right? Am I getting enough sleep? Am I eating regularly in my day? Have I moved my body, and have I connected with somebody else? That's it. Those are kind of like the 4 like kind of basics we need to be able to have like energy to address all this other stuff. And then I want to acknowledge that boundary setting is very hard, and it is hard for many people. It is not something we teach. Like, we don't even teach kids boundary setting very well, right? So how do we as adults learn it if we've never learned it in the past 20, 30 years? There are lots of good resources on that. There's some really good books. But what I would say is you start with needing to know what it is you need, right? Which means taking a moment. It means taking a deep breath, thinking about what's going on for you, and then identifying kind of the like who, what, where, when, how of like a boundary. Like, what is the boundary that's being violated? What are my values and priorities? And what do I want to do? And I would start small, because if I think too big, I'll just quit and I won't even try. But do I need to take a walk today? Do I need to not respond to some emails because I actually have some like deep thinking work that I want to do? So it starts with identifying kind of what those boundaries are, and then thinking about how you're going to communicating the boundary. Are you being clear and concise, right? There's a significant difference between my plate's full, but maybe I could pitch in, versus my plate's pretty full, but if it's a small project, maybe I can set aside 2 hours on Wednesday to do it. And then I'll send you what I have by the end of the day on Wednesday. Like, they're both attempting to set a boundary, but I think people receive those boundaries very differently. And then remembering that kind of boundary setting is a process that requires kind of regular reinforcement that's going to happen constantly. And that's normal. It is how boundaries work. And that it also might be really uncomfortable. And that does not mean you're doing it wrong or that you should stop doing it. And then kind of on the more extreme end, right? Like, but you asked about toxic work culture. Part of thinking about toxic workplaces and boundary setting is knowing when you need to develop an exit plan. And that doesn't mean tomorrow, right? I've had clients where the exit plan is in a year, but it is like starting to think about, how do I exit this situation? Because I'm not sure there's anything left in my control that I can do. And I think a lot of times working with somebody professionally, whether that is like a mentor, a coach, a therapist, can help with that. But knowing that you're working towards an exit is actually very empowering because I can control that.
Thank you. I think, or I hope I know the answer to this next question, but I think it's important for our listeners to hear the answer definitively. Can it affect your career or admittance to the bar if you seek help for mental health or addiction, i.e., Alcoholics Anonymous or accessing these programs through the DC bar?
Thank you for asking this question because I want to kind of acknowledge that like fear, right, that is around that question. There's so much fear. And in all the studies, it shows that fear is at least 50% of what prevents people from actually seeking help. So I kind of want to acknowledge and like put it out there that it is a real fear, but fear doesn't always mean it's true, right? And I think we need to kind of combat that a little bit because at the end of the day, most people who seek help end up as better attorneys and better humans with the help of recovery and whatever that recovery is for you. But let's start with that kind of application question, right? So what I'd start with is saying that we get a ton of calls or emails from applicants or law students with that fear, like, I don't know how to answer this. I just sought treatment for like grief. Like, is that going to prevent me? Or bigger questions on, I've actually had 2 DUIs and I'm not really sure if that's going to impact my ability to be barred. And my kind of overall arching answer to that is if you have sought help and you are in a space where you are relatively healthy, I say relatively because it's 2022, 2 years into a pandemic, everything's relative. But if you're relatively healthy, no, there in no capacity is that going to prevent you from being barred. Because at the end of the day, what the bar wants to know is that you're going to be a competent and ethical attorney, right? So seeking help actually improves your chances of being a competent ethical attorney. Their job is really about, the Committee on Admissions job is really about protecting the profession and protecting the public. So if you've sought help and are relatively kind of stable, for lack of a better word, healthy, that's what they want to see. And I think there's a lot of fear that because I sought help, they're going to judge me more harsh, where in fact, I think it is that you will have shown them evidence that you are healthy because healthy people seek help. It's like kind of this almost catch-22 or whatever, chicken and egg sometimes, but that is kind of what they want to see. And I also want to say, if that is a fear that you are actively having, again, like the LAP, we answer these questions all the time confidentially, and we're happy to kind of walk you through the process on like answering that question, like honestly, but in a way that shows what you have done. So that would be part of what I would say is really reach out for assistance around that if you're noticing fear getting in the way. Or if you are struggling, but you're afraid to seek help, also feel free to call the LAP confidentially, and we can kind of walk you through what that might look like. Because no, you're right. The kind of simple answer is they want to know you're healthy, and seeking help is not an indication that you're not healthy. And the same would be said from a career perspective, right? I think people are healthier the more kind of help they seek. And what I would also say to that, though, kind of as an aside, is remembering, particularly in your career, because it's different with questions on the bar application, but in your career, you get to decide who knows what information. Like seeking help is a medical issue, right? So you get to decide from that perspective of who do I want to share it with? How do I want to share it? It might be different if you're taking leave or something along those lines, but that still actually is and should be treated as a medical condition. And I think we so often forget that, like we remove that from our dialogue we have in our heads. So you get to choose who has that information, how and why.
Now, before we wrap up, I think we've already touched on this a little bit, but most of our listeners are law students. So Nikki, do you have any advice or tips for them on how to best take care of their mental health during such a stressful time in their lives?
Great question. It's a big question, right? What I would say is that when life feels overwhelming, kind of what I mentioned before actually is coming back to the basics. I think we hear so much about like well-being and self-care and do all of these things. And sometimes that can shut us down because it just feels like too much. It feels like I don't have the time or energy or ability to do all of the things I'm supposed to be doing to take care of myself. But I think if you can do these 4 basic things, which can feel really not basic, they can feel really hard under kind of all the stress, is like, have I gotten enough sleep today? brains don't function very well on continued lack of sleep. They just don't, our brains aren't meant to. And I don't mean like 5 hours of sleep, right? Like I mean like 7 or 8 hours of sleep. So am I following like good sleep hygiene? Do I have time to wind down at night? Am I giving myself a little bit of distance? I know this is sometimes sacrilegious to say, from the electronic device right before bed. Am I eating regular snacks and meals, right? Am I feeling low energy because I forgot my lunch today, or because I forgot to have enough water today, right? Like hydration and nutrition are very intertwined. So the simple, so sleep, kind of nutrition / water. Have I moved my body in some way? Everybody likes to move their body differently and everybody has different capabilities, but have I moved it? Have I walked? Have I stretched? Have I danced? Have I something? And then actually, I always include this in kind of basic needs, but I think gets easily forgotten is, have I connected with someone today? Not related to work or school, right? But have I connected someone today? Have I felt seen and heard recently? It may look different for you each day on like what that looks like and what you're capable of, and that's okay. But it's remembering that we are pack animals wired for connection, and we need it. It is like literally a bodily need. We get all sorts of wonderful brain chemicals when we connect with other people that make us feel better. So thinking about those kind of 4 questions, I would say, is what I would kind of recommend. Just come back to the basics, let go of the other stuff, and focus on that part. And I would say also, if you're struggling, that it's okay to ask for help, whether it's from a friend, a mentor, a family member, or a professional. Don't walk the path alone, right? We all are here for each other. And if you don't feel like you have somebody that is there for you, that you can be your full self with, that is why mental health professionals exist, is to be that space, to offer that support. So don't hesitate to reach out for that help.
Well, thank you so much for your time today, Nikki. This has been such an important and eye-opening episode. I really think our listeners are going to find it helpful. We hope that they learned something new. We hope that you do reach out to the lab, and don't forget to tune in next time for another episode of Let's Brief It.
The DC Bar Law Student community strives to engage and support law students before you graduate and expose you to the tangible benefits of joining the DC Bar and DC Bar communities. Curated programming allows law students to participate in substantive content programming, leadership trainings, networking with practicing attorneys in fields of interest, writing opportunities, and other activities designed to expand your legal education beyond the classroom. Make an investment in your legal career by joining the law student community. To learn more, visit us at www.dcbar.org or email communities@dcbar.org. We look forward to hearing from you.